clearly we have many, many pieces of input into this discussion. Now, climate change can also affect our health. And we know that the Caribbean needs to prepare for more cases of dengue fever and ciguatera or fish poisoning. Joining us from the Virgin Islands Department of Health is Dr. Mark Jerome. Welcome, Dr. Jerome. What is the territory's history with outbreaks of dengue and ciguatera?
During the last 25 years, there has been 3 major epidemics of dengue in the Virgin Islands. They were caused by dengue 1, dengue 2, and dengue 4. The first one occurred between 1988 and 1990. The second between 1995 and 1997. And the third one 2005, 2004, and 2005. The last episode of dengue that we had was last year on St. John and St. Thomas, and it was also caused by dengue 2. So the only dengue we have not seen yet is dengue 3, and this is our vulnerability when it gets introduced into our population.
Well, certainly is something we need to look out for. What are the biggest challenges when we have with managing a serious outbreak if we have one?
There are several factors involved. One is the warm climate involved in causing the dengue outbreak also cause an excessive mosquito breeding. The second is there is an inadequate education of our community concerning the preventative measures against dengue. The third is that we don't have a vaccine at the present times against dengue. And the fourth is that we have a lack of reporting, of case reporting, and also misdiagnosis of the condition by some of our physicians.
Well, thank you for those answers. It certainly sounds like those are serious challenges to managing the situation. So who does the Department of Health turn to when you have to respond to these public health challenges?
The Department of Health partner with the CDC, the Center for Disease Control Dengue branch in Puerto Rico, and they allow us to be able to do zero diagnosis of the type of dengue involved. We also partner with the private physicians, the hospital, and the health clinic, freestanding health clinic. Okay. We partner with the media for the dissemination of information about dengue and the education of the population. And we also partner with some agency of the government, like DPNR, agriculture, and public health in their areas of responsibilities.
Well, thank you. Now, what are your concerns when it comes to expected increases in temperature and the more pronounced cycles of drought and flooding that we expect? Is there something about that situation that bothers you or is of concern?
It is. There is a great concern about that because with the proven association between dengue and a rise in temperature, as reported by some researchers, the threat of increased incidence of dengue in the Caribbean is definitely a real one. And because there is a projection of 2 to 3 degrees centigrade increase in the rise of the temperature by global warming, that increase ambient temperature can lead to 3-fold increase in dengue transmission and also an increase in dengue hemorrhagic fever.
Well, Dr. Jerome, I hope you'll allow me to ask you one more question. I'd like to know whether or not we've had also problems with hemorrhagic fever, dengue hemorrhagic fever in the territory as well as just dengue fever. Is this a part of the disease characteristic for us when we have outbreaks?
When we have an outbreak of dengue, the majority of the cases will be the mild to moderate cases.
Okay.
but there are a certain number of them that will be the severe form of dengue hemorrhagic, like we have seen in the last major outbreak in 2004, 2005. Approximately 30% of the cases reported were dengue hemorrhagic fever.
Well, we hope that that will not be the case moving forward in the future. Thank you for your answers.
Thank you.
Yes, indeed. Thank you so much, Dr. Jerome.